Okay, joining me live is resident at Westmead Hospital, Dr. Henry Crayton. Thank you for your time this afternoon. How are you feeling after today?
Thanks for having me on, Holly. Today has been an unprecedented day. I've been joined by hundreds of colleagues across the state, junior colleagues, senior colleagues who I look up to immensely. And in one of the most emotional moments of the day at Westmead, we actually had a patient come up from ED, still attached to an IV pole, and join us in solidarity with the strike, which was really, really touching.
Wow, what a powerful moment. I mean, the part that stood out to me from that story that we just listened to from Crystal Wu, one of our reporters that was there on the ground with you guys today, was that if you were in Queensland or Victoria, the situation would be so much different. You doctors are some of the best in our society. Doctors want a pay rise and better working conditions too. What correspondence have you had with the government so far?
My understanding is that we've been speaking with the government for the last 18 months. They walked away from the negotiation. At no stage did they put a deal on the table which solved our key issues, which is we're trying to retain talent in New South Wales, and we can't do that when the conditions are so much worse. We're trying to protect patient safety, and we can't do that when we don't have safe working hours clauses. So to my knowledge, we still don't have a deal from the government.
Henry, talk us through, I mean, we've heard numerous reports and I've been reading a lot of articles about it today, but New South Wales has the longest wait times, people waiting hours just to be seen for chest pain. Talk us through what it's like for you working in these environments.
Yeah, it's difficult. All doctors want to see patients. We want to help as much as possible. And it's really hard when there's a patient who's been waiting 8, 10, 12 hours in ED, and they're frustrated at the system, and you're the face of that system. This is what the strike is about. We don't want our patients waiting for that long. And part of the reason why I believe patients are waiting that long is because doctors that might have seen them are now working in Queensland or WA or Victoria because the conditions are just so much better.
I mean, a lot of people looking at these strikes and concerned about patients being at risk, even though the union has insisted that no patient will be at risk. But it looks like, just from the images that we're seeing there, you guys are at breaking point.
Yeah, no doctor wants to go on strike. I want to be on the wards looking after patients. I love my job. I love my patients, and that's where I want to be. But the sheer nature of this, 5,000 doctors have come together and said enough is enough, because we know that if we do not get change, our patients will not be protected and they will not be safe, because long term we're going to keep losing doctors and it's going to get worse and worse.
I mean, New South Wales Health Minister Ryan Park says a decade of pay suppression cannot be fixed in just 1 year. What's your response to that, Henry?
My response to that is work with the union and let's try and solve some of these problems. At the moment, what's on the table is a below inflation level offer, which doesn't catch us up at all to any other state. Now, this is not about pay. This is about patient safety and the sustainability of New South Wales health long term. We're not asking to be the best paid doctors in Australia. We just no longer want to be the worst paid, and we don't want to be the most tired, overworked, and undervalued, because our patients deserve better.
Henry, what's your concern if something doesn't change here?
My chief concern, honestly, is that doctors will leave and that will accelerate. Some of the best junior doctors I've worked with have already left. A few of my colleagues at the strike today, I know have signed contracts to leave. And I think that will potentially accelerate if this doesn't change. And every doctor that leaves the state means a patient's waiting longer and they're getting less care.
Dr. Henry Crayton, thank you for your time today. I appreciate you chatting with us about this.
Thanks, Holly.